First, should people on benefits be made to work in care homes? 020 7862 2222 is the number, in response to the government announcing this week that it would end the recruitment of care workers from overseas. The Reform Deputy Leader Richard Tice suggested that Brits who are out of work should step in to look after the elderly or risk losing their benefits. This is him with LBC's Tom Swarbrick.
We might need to have to say to people, look, actually, if you're on benefits, then maybe actually we need to train you in things like social care and get you into a really important job.
But if they don't want to do it, what are you going to do? Take the benefits away?
Then frankly, end of benefits. You can't make a lifestyle decision to sit on your backside at home watching telly whilst other people are going to work to pay your benefits. We have to have that discussion and say, if you can work, you should work. Social care work in the community is a vital part of our communities, and people have to understand that.
So you lever people out of benefits lifestyle by saying you now have to work in a care home?
No. I'd make Richard Tice work in a care home, because I would. I'd put him in a care home for a week and see how he got on. I know we're going to hear him in a minute. What experience has he got? I find this whole thing offensive. Working in a care home is a highly skilled job. Looking after disorientated elderly people,
well, why would you ask Richard
requires
to do
loads of skills.
Yeah.
The idea that just anyone can do it, it's low skill, low wage.
Carole, before you come
Why
in.
are people not queuing up to work in care homes? Because you get paid more in a supermarket or on benefits. That's the problem. Let's pay people a decent wage, and then we get people with real experience working in care homes.
Let me see what Richard has to say. Richard, you're first in line to work in a care home, according to Phil Jones.
Phil, good morning, everybody.
Good morning.
And yes, do you know what, Phil? I'm going to take you up on that.
it.
But obviously, I would need some training first, because as you said, it's an important skill. It's a vital part of all our communities. And I was in a care home in my constituency of Boston and Skegness just recently. And what I was actually hearing was very different to what we hear on the national stage. They didn't mention the recruitment crisis. What they mentioned was the daft procedures and processes where they're not allowed to do certain things. They have to get a GP in from the local surgery, or they have to get an ambulance and take someone to the hospital when they could do the procedure in their home. Those are the things that was actually delaying and damaging patient care. But look, if there's a staffing crisis in certain parts of the country, and I accept that there may be, well, actually, then it's a great part of our community. It's a very important job, as Phil's just indicated. And actually, there are people on benefits who, for them, unfortunately, work doesn't pay because of the nature of our daft tax system. So, let's say to people, here's a good opportunity. Let's train you up. Let's get you into that workplace as part of our healthcare system. And what we've also got to do is we've got to get rid of this sort of slightly snobbish sneering or smearing away, saying that social care work is less good than other healthcare work. Actually, it's all part of healthcare.
OK, let's get Carole. What do you think?
Yeah, I think Richard's absolutely right. I mean, I think anyone on benefits who has been on benefits a long time and are getting offered jobs and turning them down should have their benefits taken away. Now, in terms of...
Hang on. Carole, I was just going to say, what if Richard had said, if you're on benefits, either we'll take your benefits away or you're going to have to write a column for the Daily Express. You'd go mad. You'd say, that suggests that anyone can do my job.
Hang on a sec. Well, anyone can
Brilliant,
do my job.
Jeremy.
Anyone can do my job. Anyone can do your job. They just have to be trained
No.
to do. Yes, they have.
No.
They've got to be trained up. They have to have experience and trained up to do. But the bottom line is, in social care, I might not want an angry, disgruntled person who's been shoved into a care home to look after my mother or my granny. However, there are other jobs in care homes. There are cleaning jobs. There is kitchen work. There is heavy lifting. There is gardening. All of those jobs can be done. Why should we all be working to pay for the benefits of people who sit in...
Well, there we are, Phil. That's it.
Because
in a nutshell. And a lot of people would say yes.
I mean, we don't pay people enough. It's you can earn more in a supermarket than you can working in a care home.
That's
it's not that benefits are so generous.
The debate is not...
Let Richard come in.
But that's exactly the point, Phil. If we constantly rely on cheap, low-skilled immigration from overseas, you'll never get the wages up.
Exactly.
Mass immigration from overseas has suppressed the wages of British workers and is the reason why social care wages are lower. You're absolutely right, Phil. We've got to address those. That's why I say social care should be part of national healthcare should all be part of one system. People should be treated and valued and appreciated in the same way we do of nurses and doctors in the NHS.
Well,
and let's drive it forward as a vital part of our community.
But the cost will go up. Now, at the moment, if people are putting their mum or dad into a care home, it is breaking the bank. You know this.
Yeah.
They sell their house, they still can't afford it, then they end up... It's a prescription to make it all more expensive, Richard, what you're saying.
No, it's not, because if you get rid of the daft processes and procedures and blockages that I'm hearing about, you'll make it more efficient and the cost will go down. This constant idea, I'm sick and tired of this constant idea that you can't improve the way things are done in healthcare in this country. You can. It needs fundamental reform. And every time I talk to a GP or a chemist or someone in social care, all I hear about is the bureaucracy, the blockages, the lunacy of the system, the lunacy of daft things like GDPR. That's what's costing so much money.
Okay, that may well be true. That may well be true.
Let me pause. Order, please, because I want to get a caller in, because Naomi disagrees with Richard. Naomi in London, tell us about that.
I certainly disagree. We often hear about the elderly being abused by their carers, and if people were forced to work as a carer, they could abuse the elderly. There are also those who are on benefits for a variety of different reasons, like mental health, who have disabilities, who definitely shouldn't be in charge of the elderly and wouldn't be able to lift either another person or the heavy equipment.
Well, somebody with anxiety has as much muscle strength as anyone else.
We have 9 million people in this country who are currently economically inactive, that's what it's called. Just be generous and say a quarter of those people can't work. You still have 7 million people who are sitting at home claiming benefits every day. Why shouldn't they be trained up? They have no right to sit at home all day. They've done nothing to deserve those benefits. They should be trained up to work, whether it be social care or somewhere else in the system.
Let's pay them decent amounts of money.
But that's not the argument, Phil. We know that.
Carole,
no, it isn't.
It is the argument.
Should people on benefits work in social care?
We have a low-wage, low-skill society.
That's not the argument.
Need to pay people. We need to dignify these jobs.
It goes without saying.
I agree with Richard on that.
Richard, will this go in your manifesto, this policy?
Well, the joy of us is that we put forward suggestions that sometimes are uncomfortable for debate and discussion like we're having superbly today. And of course, Naomi's right. Not everybody would be suitable. But I believe that some of the 9 million Carole's just mentioned clearly would. And I think a great help for someone with mild mental health issues may be the joy of helping people in care homes with training, with respect, with that dignity. What a wonderful thing. Everyone's a winner.
OK, Richard Tice, thank you very much, for joining us from, it looks like the House of Commons there behind you. Parliament, I think, that wallpaper. Thank you. All right, Naomi, what do you think? Has he satisfied you there or not?
Not necessarily, no. I mean, there are also people... Would you want somebody with a long criminal history looking after your parents?
What are you saying? That everyone on the dole has a long criminal history?
Well,
they
that'd
don't.
be the next suggestion.
She makes some very good points.
They don't.
She makes some excellent points.
I remember discussing this before on the radio. Then it was a suggestion that we should punish criminals by making them work in care homes instead of jailing them.
Well, I'm not sure that's
well, I know. And a guy who ran a care home complained and said our residents do not want any part of their body to be used to punish crime.
No, but the principle is right, is it not? We can't not have people working. We can't have millions of people sitting at home claiming the benefits that everyone...
Carole, you've got to pay them proper wages.
You keep on repeating that. We
because
know
it's
that.
a fact.
It's a given. No one's arguing.
All right.
No one's arguing with
you
that.
get paid more in the supermarket.
There's
nothing wrong in working.
I tell you what, let's pause.
It.
We've got more to come here. We've got more calls coming. Now, more calls on whether people on benefits should be made to work in care homes. The government doesn't want staff to be recruited from overseas anymore. I had a message from someone in the care home saying the way that care home staff and care home jobs are discussed now as if they're the lowest of the low.
Exactly.
They get really upset about it.
Exactly. We should dignify the job with decent wages, decent conditions, and, the idea that this is a low-skill, non-skilled job, the patience required, the skill level required to work with disorientated elderly people.
You say that, but we import people from different countries who have none of the skills
we have people
none
from...
of them.
They care, though.
Because these are from caring countries like the Philippines.
Is someone someone from Slovakia more caring than someone from Somerset? That's my question.
Well, it depends. You look at the people who've been prosecuted in the past 12 months.
Not from Slovakia.
They're not from here.
Oh, I thought they were from here.
No,
okay.
But the bottom line is that we have
I always
to
look. I just think that foreign carers are more caring. I'm sorry.
They are.
I'm sorry.
It goes without saying that they should. Of course, they should have a decent wage. Of course, there should be a dignified wage. But we're not talking. You can be trained to do those jobs.
You're now in favour of high wages. Okay, that's fine. Then no one can afford to go into a care home. I mean, it's almost $100,000 a year.
So what do we do then? Phil's shouting for more money. You're saying it's impossible. So what do we do?
Well, I don't know.
I mean,
Claire in East Sussex, you worked in one, I gather, Claire.
Hello, yes. Well, I've taken time out at the moment, but I was an admin manager for care homes, various, one charity and other various ones. And I honestly think this new crazy idea is just totally de-skilled the job yet again. There's always been a stigma attached to working in a care home. And but not everybody can do it. It is a vocation, I'm telling you. And I've worked with foreigners who've come over, lovely, lovely people. Half the time, they cannot believe why we stick so many of our elderly people in care homes. You know, they should be at home with the family. In my country, we would look after them. So, but also they are absolutely brilliant. Sometimes they don't understand the residents because the residents, especially if they're a bit older, they are slightly racist. So they come out, they haven't got any filters on them, and they'll come out with things a bit derogatory to the staff, and they get a bit upset because they don't understand how these, a lot of people have lived through times when things were a lot different. Yes, and also, another thing, do you want a cup of tea? No, they don't want a cup of tea. If you're living with dementia and you're very, very confused and frightened. So there's a lot of things. And also, a lot of these care homes will employ people on minimum wage because they are making money.
All right, but let me just ask, because hang on, you've done the administration, so this is a really simple question here. Is that the reform come into power, let's say, which is not looking impossible now, and you're on a Monday morning, Claire, you're told you've got 4 people who've been told they must work in your care home or they will not get their benefits. What job do you give them?
Well, I wouldn't let them loose on care. Kitchens, reception, until they can prove. I mean, as I say, it takes a vocation. You just can't pick off people. I mean, I agree. We need to get the unemployment down. It's wrong. People shouldn't be not working at a certain age, young age. But care, nobody can go into care, and I just think it's put another stigma attached to it. And I've had people saying to me, they come up with really good ideas, and they've said, "Oh, Claire," and they said, "Well, I'm only a carer." I said, "Get that out of your head. You're not just only a carer. You're still a human being."
You just said it there, and I said it earlier. There are other jobs that they can do that aren't face-to-face care, like in the kitchens, like cleaning.
Well, I said bins, which is probably wrong.
Like looking after a building.
There are enough of those jobs. You said there's 7 million people.
There's lots of those jobs that can be done in a care home that shouldn't be done by the people who are employed to care face-to-face.
All right. Claire, thank you so much. Derek in Northamptonshire, would this work?
Oh, good morning, Jeremy and panel. I think it probably would. I can't see any reason why not. It would also reduce our reliance on recruiting migrants from abroad to work in care homes. And actually, judging by the brochures we get delivered frequently, it looks like quite a pleasant job. You see photographs of young person having a nice cup of tea and a chat with an elderly person. So what could be more enjoyable?
Well, you don't see them being taken to the loo, Derek, in fairness, in the brochures.
And these are sometimes quite disturbed. Somebody with Alzheimer's, they can be violent, they can be difficult.
Derek,
this is not an easy job.
If you were in a care home yourself in, say, 20 years' time, and the first person who comes to care for you says, "Well, I'm only here because they said they take my benefits if I don't come," that's not a very good way to start the relationship.
Well, it may not be, but then you can talk them round and say...
You talk them round.
What the positives are of the job.
Yeah, I like that. The residents...
You did a little bit of stereotyping.
I know. Do you notice how the... I'm just thinking. That's my stereotype of a shirty, someone who's cross about being levered into a job they don't want to do. Okay. Cheryl in London, hello.
Hello.
Do you think it's okay to say you can't get your benefit unless you at least do the tidying up in a care home?
I think this is a difficult one because I think you need a real aptitude to work in a care home, even if you're only cooking dinner. because it's a calling. It's not something that is done lightly. I spent 11 years working, and I also in adult learning disability services. And I spent a whole 2 years training. And this idea that the people from different countries are coming over and they're making it so that it's too cheap, so that it's always been a low-paid job.
Yeah. Well, there we are.
It's always been. We're talking about the 1990s when I was working. It's got nothing to do with immigration.
Yeah.
It's to do with a lack of society basically valuing the job that they're
also
doing.
councils don't have much money. They put a lot of people in care homes. They pay. They push the prices down. Thank you, Cheryl. Gaynor in Leicestershire. Should we force people on benefits to work in care homes? That's the Reform Party's idea.
No, and I feel quite strong about both points here. I think my mum had dementia towards the end, and she got quite challenging. You've got to want to, it's vocational, you've got to want to do the job to look after the individuals. I think there'd be better use. I think they should do something to earn the corn, whether it's working for the councils, the state of the potholes, the rubbish, the overgrown walkways, graffiti. Surely putting them to use better that way than in a position of care, because then they're going to have to be shadowed by somebody else, thus wasting more money.
OK, thank you, Gaynor. Lisa in Leeds, what do you think?
I don't think they should be put into care homes. I am a carer. There is such rigorous training. You've got to have even an NVQ2 to work in the kitchen as a kitchen assistant, possibly in the garden.
That's the whole thing that Reform is saying, that these red tape is just nonsense. The idea you've got to have 7 fire doors when you've only got 6 residents,
well,
you know.
Yes.
You have a fire or you have abuse,
that's right.
you know.
Yeah, that's true.
And I agree with your panel member there, the gentleman. We are treated really badly. The whole care system needs to be turned on its head and reformed, because we don't even get sick pay when we're off. If we're run over by a car and we're off for 6 weeks, we don't get paid.
Wow.
The conditions are horrendous for carers, and it is a vocation. And it's really poorly paid. I do agree that the foreign people that come over are far better carers than the English, generally from what I've experienced. But they're treated badly because the owners of the homes know that they are vulnerable, they're on visas, they need their money, and they get given extra tasks which they don't refuse because they're too scared to.
I'm just trying to cram in as many calls as I can before we move on. Sorry, thank you, Lisa. Liz in London, hello.
Hello, I can't believe I'm actually saying this, but yes, I actually do agree.
Right.
I'm not a fan of reform, but I think you can learn caring skills, discipline skills, active skills. I've got one of those beautiful individuals, a Gen Z son, who hasn't recovered since lockdown and COVID, and it would do him no end of good to find out the coalface of providing care. I do also think, though, that it shouldn't be so profit-based. It's a better idea than insurance for reform, though, because if they change in the NHS to insurance, they won't get in, because the British, even the bluest of the blue, will never give up the NHS. It's in our blood. It's in our DNA.
Well, it was. That's a different debate. We may, at the moment now, be thinking it's not working because you can't even get a GP's appointment. Thank you, Liz, and I hope your son gets better. Last call on this, Dorothy in Peterborough. Hi.
Hello. I feel that it's degrading pensioners when qualified people are not working there. And, do they have empathy? Do they have compassion?
I don't know.
The pensioners have had their fuel taken away, and now they're going to go in homes and not have people working there that are, really qualified.
They don't want to be there. Thank you, Dorothy, so much. Let's remind you what's still coming up on the show. In a moment, we're asking if female guards need to be banned from working in male prisons to stop relationships forming with the inmates.